Taking action with action. Cancer incidence in Southeast Asia is expected to increase by 70% by 2030. And it's affecting younger people. There is an urgency to understand the problem and to build effective cancer control policies and programs now. The Action Study engaged 9,513 cancer patients across 8 countries in Southeast Asia to investigate clinical, quality of life and economic outcomes. It is the largest observational study on the household burden of cancer ever conducted in Asia. Patients with all types of cancers treated in both public and private hospitals were included in the study. The need for action. The Action Study was initiated to fill some key data gaps. Country data on cancer incidence and burden is limited, while data from global registries can be incomplete and inaccurate. The study results were published in August 2015. After 12 months of diagnosis, 75% of participants had either died or suffered financial catastrophe. Those who did not suffer financial catastrophe, which is out of pocket of medical costs exceeding 30% of an annual household income, had some type of economic hardship. The study also showed that more than 50% patients were diagnosed at late stages. Action for better cancer control policies and programs. Evidence-based policy is public policy informed by established objective evidence, an extension of the idea of evidence-based medicine to public policy. Policy processes are complex and rarely linear or logical. Simply presenting information to policymakers and expecting them to act on it is very unlikely. There are 3 distinct stages for evidence to translate into policy. Recognize the problem. Identify the policy. Understand the politics. Successful advocacy is one factor that affects policy-making process. Case studies show that policy entrepreneurs or champions have played key roles in policy reforms. Physicians are important champions in the path for evidence-based policy adoption. They have both expertise and broad public credibility, which position them to shape national health policy development. Research-based evidence can contribute to policies that have a dramatic impact on lives. The Action Study aims to enact evidence-based cancer control policies in the fight against cancer. Who will be the policy champions for cancer control in Southeast Asia? Will policies be ratified to have a dramatic impact on the health, economy, and lives of people in the region? Let's take action now!